Grade 1 and 2A, they just immobilize it, put them in a cam walker, splinting, casting. You can weight bear with the assistive device, so you can weight bear with like a cane or a crutch or something like that. Get some manual therapy, some mobility exercises, range of motion, no strengthening after that. Phase 2 is if pain and edema is controlled, you can start doing some resisted exercise. And then you can progress to phase 3, which is more advanced training, the single leg balance, more specific balance exercises, strength training, more functional stuff, plyometrics, and sport-specific agility drills. So this is what the surgery looks like. There's a screw fixation surgery, which is what you see here is a plate on the outside of the ankle. 2 screws go in, one above, one below. What they end up doing more of now is the tightrope right here. So it's a more accurate reduction. It's a significantly better ankle motion. And these players go back to the sport much faster. And this is what the tightrope looks like. So what they do is they actually drill a hole from the outside to from inside to outside. And they thread through I don't know what it is, metal thread, I guess. And they anchor it on the outside and just pull it tight and then keep it that way. So what they're doing is taking this widening that occurs here and just narrowing it. So they allow fixation here to kind of mimic what the ligament does in the middle here and what these ligaments do, but it still allows freedom of movement in the ankle. So you don't have the problem of stiffness that you would see on this guy. You can see how much stiffer and less movement you'd have here in your foot as opposed to that. Much less invasive. Players do really well. We had one guy do the tightrope surgery last year, and he's doing really well. So again, mobilization in the cam walker, about 2 weeks. They can start walking about 4 to 6 weeks, based on the athlete, how they're feeling, what their ankle's looking like. They return to cutting and sport activities after about 8 weeks, after starting running at about 6 weeks. So recovery from the surgery is pretty fast. They actually do really well, very few complications. It's just a really nice surgery for most athletes. This is just, so some of the things that they look at are the single leg hops, the wide balance, star excursion, forward lateral hop test, shuttle run. This is all criteria you guys can use to, if you need to return them back to plyos, let's say. This is stuff you can do with them and get some numbers and see if they're really ready for that kind of stuff. Again, just some more stats. They looked at return to play, and what they found was, let me find the one slide I want. So here's the time to return to sports, what they found, what all that study looked at. All returned to prior level, so they all went back to their prior level of sport. The mean average was about 45 days for 2A. For 2B, where there was ligament involvement, there's actually about a little bit longer time, 64 days. So if you have a combined injury of the ligament and the other deltoid ligament, which is one of the other ligaments down there, it had more of a delayed return to sport because 2 things had to heal, as opposed to combined injury of the other 2 ligaments. They had an earlier return to sport, only at about plus or minus 14 days, which isn't bad. So this study concluded that the squeeze test that I showed you and the injury to the deltoid ligaments are important to determine how unstable the injury is and what time you're going to get back to sports. So when they start harassing you about when can I go back to playing, when can I go back playing, you see how sensitive that squeeze test is, and just look at their imaging and be like, well, you got a tear here, and this is really limited, so it's going to be a little bit of a while. So some of the things they talk about, I'll just go through this real quick. They're doing Prp injections. If you guys aren't familiar with those, that's a platelet-rich plasma. They remove some blood from your arm, they put it in a centrifuge, they remove the platelets from the plasma, they re-inject the platelets back in the location of the injury, stimulating a healing response. So it's not really proven that it's effective in a lot of different things, but this is one of the things they use it for. This study just looked at 16 athletes that they did it to. We've had some guys do it too. They looked at different factors. So return to play, they had 40 days for the PRP group and 59 days for the control group, where they did just traditional rehabilitation. So there was an increase, a less of a delay in returning to play for the PRP group versus the other group. So it could be significant improvement there. 1/8 of the return to play, 1 out of 8 with the return to play to minor discomfort, and 5 out of 8 in the control group, and 1 required surgical fixation. So much better stats in that way as well. They do make orthotics for the high ankle sprains to fixate them in a certain position, so it puts less strain on the joint. There is bracing and taping techniques, which I'm not familiar with. I'm not an athletic trainer, but I know taping techniques that they use for that as well. They did, and I'll just mention this real briefly. They looked at hip strength and ankle injury. There's this really strong correlation with that. So we're finding that kids with more ankle sprains in general have weak hip extensors, weak glutes typically. And there are actually a lot of studies that are coming out now talking about that as well. So if I were you guys, I would work a lot of glute strength for stuff to prevent ankle injuries. So that's what that study says. The foot core system is something I came across. It was interesting. They basically, and I'll give it to you guys if you guys want it. Just ask me for it whenever. It's basically working the intrinsic muscles of the foot, those really small muscles within the core of the foot, and they're teaching them to actually contract those muscles, gives you better balance and more foot stability. So they have a whole system of how they do that. I looked through it. It's kind of interesting, but I wanted to throw it in here, throw it out there to you guys, because it is actually something that we don't address a lot. And after somebody who's been immobilized, especially a foot or ankle surgery, their feet are so flat because there's just no tone in their feet. So this is something that really could help that. So they just talk about that in general, how to do it. They use actually electrical stimulation to do it too.